Hi, I'm Tom Eschen, and welcome to the award-winning Power in Politics podcast, a conversation about the issues that are impacting you the most with the people that are making the decisions, the advocates, and everyone in between, holding them accountable along the way, too. Today, we sit down with New York State Comptroller Thomas Dinapoli, who's projecting a $30 billion budget gap in New York State by the end of the decade, and he says that's not tied to federal funding at all. The other factors we discuss that are leading him to make that conclusion and what New York State needs to do to potentially make up for that budget deficit that is oncoming. We talk about a lot of different issues, including Zohran Mamdani, and if he's elected mayor of New York City, how that could have a ripple effect on the budget of New York State when it comes to his policies. I ask him about Raise the Age funding, master plan for the aging as well, all-encompassing conversation with Tom DiNapoli today. Thanks so much for listening. As always, you can listen wherever you get your podcasts at Power in Politics, or you can watch on the CBS 6 Albany YouTube page. The New York State Comptroller, Tom DiNapoli, joins us today. We really appreciate your time. Thanks for coming in.
Good to be with you.
This comes off of your report on the state fiscal year 2026 enacted budget and the first quarterly financial plan. Obviously, a very long document and report as you did your analysis of the budget office and whatnot. Just broadly, what did you take away from what you saw there?
Well, I guess the good news is the budget is holding together for the current year. The concerning news is that there are significant out-year budget gaps, cumulatively about $34 billion. So it really underscores the importance of looking carefully about where this economy is headed. What will that mean as far as tax revenue coming to the state? And obviously heightened concern about what the impact will be of the decisions being made in Washington. The federal budget, the reconciliation bill, as we've all been reading, targets some significant cuts that will impact New York's budget and financial plan for many years to come.
And you look at the three-year budget gap, $34.3 billion.
Right.
What factors into that? And you mentioned the federal, and I believe that wasn't part of that. That was more of the outlook, right?
That's a very important point. I'm glad you raised it, because what it points out is that the gaps were built into the budget without even anticipating what was happening in Washington, which is one of the concerns I identified when the legislature and the governor were working on the budget. Remember, it was a little bit late this year, but they were grappling with important issues and certainly wanted to make investments in important areas. Education, healthcare, always the big cost drivers. And the governor had an emphasis on the affordability question. So in terms of tax cut for middle-class New Yorkers, expansion of the child credit, tax credit, the rebate checks that some folks will be getting soon. All those are worthy policy decisions and choices. However, it built in gaps in the out years. And one of the concerns I said is we're already hearing Washington is probably going to have some cutbacks that will target a state like New York. What's the contingency? What are we building in? There really were no contingencies. So now that the division of budget certainly has indicated a weakened economic outlook, which could impact on tax revenue, and certainly have substantiated that we have these out-year budget gaps. And we have to factor in now, as we've tried to really understand what those federal cuts will mean in terms of a direct impact. I really think next year's budget process is going to be much more difficult for the legislature and the governor to continue to provide the kind of services that New Yorkers expect, balancing all of the needs. And, some folks say the answer is cutting some programs to balance. Other folks say we need to raise more revenue, more taxes on the wealthy, it was often talked about. I always hope folks do not say, let's borrow more money, because we already owe a lot of money in New York. So I just think some of those choices are going to be a little more difficult as we get into next year's budget process, especially if the economy does start to slow down. It's hard to know where it's headed. We see the job numbers already are slowing down. On the other hand, the stock market is very high. We get a lot of revenue when Wall Street does well. So a lot of contradictory trends right now. So we've got to keep a close eye on it.
You mentioned some different factors there. But simply put, I think people hear some things like budget gap and deficit, debt, and they see these numbers. What does a budget gap mean? I guess, what is an impact of a budget gap at the end of the day?
Well, look, at the end of the day, we always balance the budget, right? That's what we're expected to do.
Yeah.
So, the challenge we have in New York, and for a couple of years, we actually were in a better condition. Some of it had to do with all the federal money that came in during COVID. And I remember I served in the legislature for many years, a long time ago. We always seem to start every budget cycle with a budget gap. And what the gap really says is that based on current law and current spending choices, there's an imbalance between the amount of money that's needed budgeted for programs and the amount of money that's projected to come in revenue-wise. So it doesn't mean anything tangibly until you get into the nitty-gritty of negotiating a budget. So let's take the current year, for example. What I said earlier is that the budget was holding together. That is even considering the fact that we have, with the federal cuts coming, $750 million hit in the current year budget. It's not a concern because on the scale of a $254 billion budget, it's not a big amount. Plus, we look at revenue coming in and spending on a monthly basis. What we found in our most recent quarterly report as far as revenue, we're already up about $580 million compared to projections on revenue. So that's why I say for now, the budget's holding together in that the revenue is holding up. It should be able, with smart management, cover whatever shortfall there will be from those early cuts. But what it'll mean, the gap for next year, is that when the governor presents her budget and the legislature starts negotiating on it, they've got to come up with a balance. And if there is continuing to be a gap, if the revenues don't come in higher than currently projected, it's going to mean having to save some money with programs, perhaps looking for more revenue, and figuring out how to come up with a balanced budget by the end of the process.
It's holding up, but is the state behind in addressing it? I know there were calls during this. I know budget watchdogs said, the state needed to do more during the budget. Right. You've heard calls for a special session, before even the next budget comes out, the federal. Is the state behind?
Well, I would say this. As I said earlier, I would have liked to have seen some contingency built in at the time the budget was put together. And we do have reserves. They're lower than they had been because some of those reserves were used to pay back the unemployment insurance loan that New York still had, which was a good policy decision. But, I would say, and I will respect whatever the legislative leaders want to do, but I think for now, the budget is holding together. There's not a crisis right now. I think those that are calling for a special session want to try to get ahead of these gaps and the federal cuts. Keep in mind it's the end of the summer. The budget process will really kick off in November, which I hate to say it isn't that far away. So I don't know that it's required. I don't get a sense that either the governor or the legislative leaders want to call people back because, the tendency is when you call people back for one purpose, there'll be a laundry list of several other things well, wait, we didn't do this last session. Maybe it's time to, So my hunch is that you will not see a special session, and I don't think there'll be an immediate pressure on the budget. But certainly everyone's going to have to hit the ground running in January to really try to figure out how we're going to get this budget to be in balance and how we're going to cushion against the federal cuts. Will the state have the ability and the resources to backstop all those cuts, particularly in health care? The potential for, with the changes on the essential plan and Medicaid, it's estimated as many as 1.5 million New Yorkers could lose health care coverage. And it doesn't mean they're not going to get health care, but how are they going to get it? They're going to end up going to the hospital emergency room as their doctor's office. They can't pay for it. Ends up being covered by the charity pool. So there's always a cost involved. So there are going to be some real consequences of these federal cuts. And we're going to have to figure out how are we going to deal with it? Are we going to be able to use some of that money we have in reserve to cover some of this? Probably not all of it can be covered. Will the economy bounce back to the point that revenues will come in higher than projected, take care of some of that gap, take care of some of those cuts? All this remains to be seen, but that's why we have to monitor carefully what the economic trends are, the revenue trends are, and the spending trends are.
Do the changes in Medicaid, I guess specifically, the fact that they don't start until after the election in 2026, does that factor in at all here? Does that matter?
On the Medicaid side, some of them will start sooner than that, but you're right, they are being phased in. One of the areas which I think people are very concerned about, where you're absolutely right, they don't happen until after the midterm elections, surprise, surprise, has to do with SNAP, the old food stamp, as we used to call it. Yeah. This issue of food insecurity is a big one. We felt it strongly during COVID. Even now, about 1 in 8 households in New York are facing some level of food insecurity. So those SNAP dollars are very, very important to many families across the country and even in our own state. And that's, I think, something everybody would agree. Families, especially with children, should have access to nutritious food and not be going hungry. The fact that those cuts won't hit until after the midterm, I think, when people start sounding the alarm, but nobody's really feeling it directly, there's not that sense of urgency. So there was certainly some devilishness in the details of how these cuts are being implemented.
You bring up SNAP, and there's a part of your report that talks about New York's error rate being higher and that changing the dynamic a bit from the federal government. Can you explain that a little bit for us?
It's a little complicated,
It is.
right? Because
that's why I asked.
You remember with the federal negotiations, there was some push from some of the Republican senators to say, wait a minute, how is this going to impact us? And we've got a lot of families that depend on this. So they came up with this formula where basically if you have this higher error rate, the cuts would be delayed it's almost like saying, all right, if you have this high error rate with how the benefits are calculated upon a final review, we'll give you more time to straighten it out. It was really done to help get some of the Republican votes from some of the Republican senators in states where they were concerned about that. It will mean for New York, give us a little more leeway in terms of getting to the point where the cuts will actually happen. But it doesn't make it simple to fully understand this. It's also part of when we're talking about these issues. Some of it are direct cuts in programs. Some of it are increased costs as well. Administrative costs. It's going to cost more to administer some of these programs. Some of the work requirements, for instance, that are being attached to some of the benefits. Some folks may say, great. Well, it also means having to have more compliance and more monitoring. And I think part of these administrative add-ons will also discourage people from applying for the benefits. So there are many complications with just how this whole federal structure is going to be imposed on us.
You speak to the budget process next year, principally, but also I wanted to ask you about the governor. As we know, in the next few months is going to start signing bills or vetoing bills. Should this outlook, should these forecasts have a factor in her decision to maybe sign or veto a bill? Considering a financial implication of that legislation?
Yeah. I mean, any bill that has a budget impact is supposed to have that discussed in the sponsor's memo, and sometimes we have to provide a fiscal note, certainly on any of the bills related to pension fund, as you know. Yeah, I mean, I think traditionally governors look at affordability, in terms of cost, but I think there will probably be a heightened need to sharpen the pencil and really look at the benefit of whatever the legislation is, depending on the fiscal impact, especially if it's a longer-term impact, because I think that's the concern I would identify. It's what we do with the controls, right? The legislature tends to look at a particular session or a particular budget year. We tend to look more, what are the implications of a spending decision today, not just for the coming year, but 2, 4, 5 years out. So I do think some of the bills that may have a cost factor will get a little more scrutiny, and probably should in this environment than perhaps they would have in the past.
When it comes to streamlining costs, I think the governor has mentioned we need to find places that we can be more efficient. You say that in here. That's one of the criteria, and that comes with workforce. But you had one of your recent reports is regarding overtime. Docs is a big part of that, and you talk about shortages in labor, and especially what they're dealing with, and corrections officers. Docs has the biggest amount of overtime out of anybody. How big of a hurdle is that to overcome to be able to even save at this point, when you're not even breaking even there?
Yeah, well, it's a problem. Certainly, in the overtime report, we found that costs were up 10%, $1.3 billion in overtime. Part of that is a staffing question. You're absolutely right. And it's interesting because, so there's always a delay, right? We looked at last year's numbers. The state workforce coming out of COVID actually has been increasing, but not been increasing to the level. The state workforce is still lower than it was pre-pandemic. So for those institutional kinds of agencies, you mentioned docs and mental health and OPWDD, those are the big drivers as far as the cost of overtime. So part of it does get back to that challenge of recruiting and retaining a workforce so that you could hopefully reduce those overtime costs. But we are at a time where the state has been trying to ramp up as far as staffing levels because there are big service needs out there. We had a lot of retirements that accelerated during COVID. So I mean that is a challenge. But I've always said when people criticize overtime, because overtime is a direct cost, right? It's premium pay. It also gets factored into pensions. Sometimes people don't realize that. Sometimes folks, well, those pensions are so high. Well, part of it sometimes is folks accumulate a great deal of overtime, especially towards the end of their career, and then that becomes a recurring cost. If you want to deal with that, part of it's hiring staff and recognizing that you have to have adequate staff levels in the long run to reduce those overtime costs. I mean, that's just one cost area. Look, one of the biggest expenses is healthcare Medicaid program. And you know we do audits all the time on lots of programs, including Medicaid. And we've often found opportunities to save money in the Medicaid program without hurting services. You don't want to hurt people, but there are inefficiencies built into the program. Sometimes there's some fraud too. What I found over time, it's really more about inefficiencies and waste than about outright fraud. But I think if we use the pressure of what's coming out of Washington to really redouble our efforts. I've always said, I wish the folks at the Department of Health would read our audits and instead of sometimes pushing back, embrace our recommendations because we think they can save money and not hurt people. And I think there's going to be more of a need for us to do that. You know, over the years, governors have repeatedly convened Medicaid redesign task forces to, bring stakeholders around the table. How can we be more efficient? I think now there's going to be more of a need to do that.
Because it feels like there has been more of an emphasis on, I don't want to say the word blaming, but it's called the 7 Republicans in Congress to not do these cuts instead of maybe the alternative, like you just said, right? It's become sometimes political in that.
Oh, no, look, well, shock of shock, right? Hence power in politics, right? I mean, that's what it's all about. But look, I don't think it was inappropriate to say that although New York is viewed as a very blue state, that we do have Republican members in the House that need to convey to their majority and to the president, to the extent they have that influence, what some of the impact is directly on the state. You know, you look at communities across New York. We did a report on rural health care, as you know. Yeah. Some of the counties where we found some real issues about access to quality health care, high percentage of folks on Medicaid are in red counties, represented by Republicans in Congress. So some of their constituents are going to be affected by these kinds of cuts. So I don't think it was inappropriate, to say, hey, you better see how your folks are going to be impacted by this and try to have some counterbalance to what's being proposed. Obviously, in terms of the success, I would say it was not as good as we'd want it to be. But the Republican members did push hard as far as the SALT deduction. That's been a big issue, in many parts of the state as well. I think they used some of their capital more for that than on dealing with the health care cuts. I wish they would have put some of their political capital on mitigating against some of those health care cuts.
I do have a question about New York City because you talk about long-term finances, and New York City plays a factor there. And you were on with one of my colleagues, David Lombard, a month ago, and he asked you about Zohran Mamdani and about an endorsement. Talking with him, you brought up some concerns about Israel. I want to ask you about the financial impact of potentially some of his policies. Yeah. Is that on your mind at all when it comes to supporting him or his election in New York City, knowing that it could have a ripple effect across the state? The financial portion of his policy platform?
Yeah. Well, I mean, keep in mind, New York City is a creation of the state. So there's a lot that is being proposed that cannot be implemented without the governor and the legislature, going along with it. Like on tax policy, on income taxes, I mean, you need state approval on that as an example. The city controls property taxes, but, other kinds of taxes, sales tax, so on, you need state authorization. So I would say, look, New York City is going through quite a debate right now, as you know, on policies and candidates and personalities as well. We'll see how that all plays out. But I think it's important to keep in mind that when the dust settles, some of what he's proposing would in fact have to be approved by the state legislature. So that will require another level of negotiation. And, look, by the end of the campaign, as we all know in any campaign, candidates put out proposals, and then as they learn more, as they listen and they hear, sometimes those proposals get moderated and changed by the time that they're sworn in. So we'll see. It's been a busy summer, but I think it'll all pick up in earnest in the fall, and there'll actually be debates between the candidates. We'll see how it all sorts out.
Do you align with any of his proposals when it comes to New York's finances? Well, whether that's a government-funded grocery store or taxing the rich, those are two of the big ones that have come out.
Well, look, keep in mind, wealthier people already pay they pay greater taxes, and the top roughly, like the top 2% pay, well over 40% of the total income tax that we collect. So there's always that debate of, well, can they pay even more? And look, that's a fair debate, and that ultimately will be decided by the legislature. I'm not going to weigh in whether we should or we shouldn't. I just think that we need to be mindful, and we track this as well, that we do have taxpayer migration, from New York. Not everybody is leaving. Not every rich person is leaving, but we do have a net decrease of higher income people moving out of state or changing their residence and paying part-time taxes. And again, because we do depend significantly on personal income tax, particularly at the state level, the city has the property tax as well. They're a little less dependent directly on it. We don't want to be losing taxpayers. We need, it's same thing about Wall Street. People suddenly criticize Wall Street. I always say, well, we want Wall Street to still be in New York because when those people are here making money, we tax them. That helps pay for all those other programs that people depend on. So look, I think all this needs to be weighed and looked at. The city budget has to be managed as well. The city budget is similar to the state. There are out-year budget gaps. The city, and we've criticized this, they haven't done as much in building up reserves as they should have. The city economy is important to the state economy. So I think all of this is going to be, whoever the next mayor is, going to have to weigh all of this. I guess the somewhat better news for the city is that the federal cutbacks a little less directly affect them, although some of the cuts on the social assistance and education would impact them. And of course, if the state has to cut back on funding, because so much of the state budget gets passed on to the city and school districts across the state localities, that could impact on the city in terms of their plans. So a lot of things may be proposed in the campaign, but if the money isn't there to pay for them, there may be a certain reality. And one other thing I didn't mention earlier, just keep in mind why we look at the federal relationship. In any given year, between 35 and 40% of the state budget is federal dollars that pass through, and then most of that's passed through to the local level. So this federal-state restructuring of the relationship, big implications for all of us.
Yeah. So no endorsement yet.
I don't think you heard of it.
I did not. I do have two quick other topics to get to before we go. Just two quick questions. One is raise the age funding. You did a report on that recently. There's been some legislation, some calls to change the way the funding mechanism works. Instead of reimbursement model, localities would get it up front. Is that a solution, do you think, to this issue of that money getting out the door?
It could help. I mean, that's one of the concerns. One of the reasons why I did the report, just kind of track what's happening with the money. There are also proposals, not just on the funding level, but also to change some of the requirements there. My guess is that'll be one of the hot topics in next year's negotiation. But helping the counties have the money to make sure they implement what's intended with the law, I think would be helpful.
And then you also had a recent report coming out of the release of the master plan for the aging, New York support of aging New Yorkers. It was interesting, the timing of all of that. Just broadly, your take on what some of those, there's 100-something proposals in that master plan for the aging. What is your perspective on that issue?
Good news is we have a master plan.
Yeah.
But what we need to do through the Office of the Aging, provide the kind of support and coordination, because much of this is done at the local level through the counties and their Office of the Aging. There hasn't been the level of coordination and support to make sure the goals of the plan and the goals of the services that have been on the books for a while are being met. Because you do have wait lists, you do have people that are waiting for a service, particularly in-home services, keep them out of a long-term care facility. More support coming from the state level, I think that would help us provide the services to our older New Yorkers that they're entitled to.
Comptroller DiNapoli, thanks so much for your time.
Thank you.
Thanks for listening. Hit the subscribe button right now so you can stay up to date on these news-making conversations about the issues impacting New Yorkers the most: power and politics.